I know the surprising reason why you have a knot in your butt and how you can get rid of it for good. You may have noticed that there's a knot in your butt and it feels like you're sitting on a racquetball or a marble, depending on the size of the knot. And you're wondering, how did it get there in the first place? Because I don't remember doing anything that caused it, and what I can do about it. First off, let's discuss what causes a knot in your butt. So a knot is actually when the muscle is stuck in a contracted position, or part of the muscle is stuck in a contracted position. So a lot of muscles are very long and cover a lot of space in our body, but part of it can get contracted or stuck in a contracted state. And that's what actually causes the knot. And people think that it's actually like a knot, like you tie a knot in a string. It's not actually like that. It doesn't actually wind up like that and get stuck. What happens is that the muscle fibers are supposed to be able to contract and relax, and that's how they move. They actually glide on each other. So part of the muscle can get stuck in a contracted state, and that's what gives you that experience of the knot. Now, the real reason why this is a big deal is not just because it's an annoying knot, but because it affects how the rest of the muscle is able to contract. You see, if part of the muscle is stuck in a contracted state, it makes it more difficult for the rest of the muscle to be able to contract and relax, which means that muscle is not going to be functioning correctly, which is going to put increased stress on other muscles and may cause malalignment issues and other such things. So it is important to address this because it can lead to bigger problems, especially when we're talking about a knot in your butt, because often this knot is actually the piriformis muscle, which the sciatic nerve goes through. So if you get a knot in your butt and then it causes increased pressure on that sciatic nerve, it can actually lead to sciatica. So this is called piriformis syndrome, which is not exactly what we're talking about today, but I want to make sure that you know the importance of dealing with the knot in your butt because it can become a bigger issue over time. So if you are having a knot in your butt, definitely watch. We're going to talk about some things that you can do to eliminate your knot, as well as understanding what the root cause of it is so that you know how to keep it from coming back. Okay, so the knotted muscle is in your butt, which means it's either the glutes or the piriformis. There can be some deep hip internal and external rotators in there that get knotted up, but usually those are more difficult to perceive. And what we're talking about today is a knot that you can feel either while you're sitting on a hard surface or while you're laying down in bed. So this is a knot that's very close to the surface, which means it's usually the glutes. If it feels like it's a little deeper, most commonly it's a piriformis. Now, you may have fallen on your glutes and gotten a knot in that muscle, and you probably had bruising and you could see it. Sometimes it gets really purple and lovely colors. Then you know exactly what caused the knot to happen in the first place. Now, there's still some tips in this video for you, but for those of you who don't know what caused this in the first place, understand that there's some reason this muscle tightened up. And it's important to know that root cause so that you know how to keep it from coming back. So we're going to say that you didn't fall on it, so you don't know the root cause. So what is going on in your body that is causing that muscle to become overly contracted and stuck in that position? It could be that you have a muscle imbalance that's causing that muscle to have to compensate too much. Most commonly, if the glutes are not activating appropriately, it's because of either a pelvic malalignment, poor posture, or overuse of the glutes, because the muscle is having to work too hard, which is causing it to tighten up. Now, a pelvic malalignment is when your ilium, those are your hip bones on each side, twist and turn on that sacrum, which is that heart-shaped bone in the center. And this can cause increased issues throughout your pelvic girdle. So you may be feeling this down the front of your thigh. You may be feeling that knot in your glute. You may even have tension down the outside of your leg as that IT band has tightened up. All of these things can go together with a pelvic malalignment, but you may have noticed the knot first because that's the most noticeable type of thing. Now, a lot of people are surprised when I talk about poor posture and how it can cause problems in your glutes. But see, if you're in kind of a forward bent position, you're putting more of your weight anteriorly, then your glutes try to tighten up to pull you back up. because it's easier for your spine to work when your head is on top of your shoulders and your shoulders are on top of your hips. And so it becomes very difficult when you're bent forward. All the muscles on the back of your body have to work extremely hard to try to keep you in this upright position. So the glutes can kind of grab on to try to hold on to everything, and they can get really knotted up. So this might be you if you have knots on both sides that you're able to palpate or feel with your hands, or feel when you're sitting or laying down. Okay. So what can you do about it if you have a knot in your butt? Well, the first thing I'm going to recommend is that you do some self-massage to help release it. Now, it can be hard, especially if it's that piriformis, which is a pretty deep muscle in the buttocks. So if you need to use something, I recommend a racquetball. It's pretty firm and it can help to get to those deeper muscles. Now, I prefer when you're starting to use a racquetball, especially in your glutes, that you do it up against a wall or a door, because that way you're able to control how much pressure is being put on there. Some people will recommend that you do it laying on the floor. I would caution you with this, at least initially, because when you're laying on the floor with a racquetball underneath your glute, you're causing a pelvic malalignment issue. Now, this might be okay for you because you may not have an inherent pelvic malalignment issue, but if you do have one that maybe you're not aware of yet, it can cause a lot of problems and increase stress and actually increase that pelvic malalignment. That's why I prefer to do it up against a wall initially. That way you can control the pressure and you can control your pelvic alignment. However, if you feel like you can't get deep enough in it using the wall, you can definitely try laying on your back. Just be really careful of how you're controlling that pelvic alignment, because I don't want you to use this tip to cause further problems. The other thing you want to do is make sure that you're stretching the muscles appropriately and that you're activating the muscles appropriately. So I'm going to link a video here that's actually the hip routine that I do every single morning to make sure that my hip muscles are stretched out, but also are allowed to contract and relax through their range of motion. You see, the problem is that the muscle will forget how to contract and relax, hence the knot. So we don't want to just do strengthening exercise or just do glute exercises. We want to do exercises that work the muscle through the range of motion so that the entire muscle remembers how to work correctly again. So if you're looking for a really thorough hip routine, I'm going to recommend you go check out that video. I will offer a word of caution though. If you are having any sciatic symptoms or any nerve type symptoms that are going down your leg in any kind of way, I do not recommend those stretches and exercises for that. These exercises and stretches are for people who are having muscle problems and not having nerve problems. They're a little bit more aggressive than the exercises that I would give to people with nerve problems. I tend to back off on those exercises and not necessarily work the tissue all the way through the range of motion. So if you're having nerve symptoms, please don't go do those videos. It may actually increase your symptoms, and I don't want to have that happen. Now, if you try the racquetball and you try the stretches and you try working the muscle through the entire range of motion and it's still not resolving or staying resolved, then I would highly recommend that you seek out help from a manual physical therapist, because obviously there's a root here that's not getting addressed appropriately that's causing this muscle to continue to tighten up. So I would recommend finding someone who can help you understand if it's a pelvic malalignment issue, if there's a postural issue, if there's a muscle imbalance issue, so you know exactly what you need to do to get rid of that knot and get back on your way. All right, so there it is. The main causes of a knot in your butt are a fall directly on your buttocks, poor posture, pelvic malalignment, or a muscle imbalance, which means to address it, if you fell, you probably need to ice and just give it a chance to recover. But if you have a pelvic malalignment issue, poor posture, or a muscle imbalance, you need to figure out the root cause of that so that you can get back to doing the things you love. All right, so now it's over to you. Which of these tips was most helpful that you're going to integrate into your activities today to deal with the knot in your butt?